Welcome to NMP Talk Show, the show that keeps you well informed and engaged with topics about your mental health, wellness. And today we're talking about something very special. I'm saying special because a lot of people around the world, it doesn't matter where you're located, we're suffering from such diseases. And we're talking about rheumatism. And the doctor here also would give you another explanation of what rheumatism according to her research. And if you do have any questions, please don't hesitate. Contact us. Let us know. Raise your hand there on Telegram, and we'll be able to send you. To respond to your question. We're also streaming live to YouTube. Yes. So if you go to our YouTube channel, you can type your questions there, and we're able to post them on the show as well, that we can answer you. So our guest is Dr. Saimun Singla. Dr. Saimun Singla, how are you doing? Welcome to NMP Talk Show.
Good. Thank you so much for having me as a guest. It's an honor to be here.
Oh, it's such an honor for us as well. I mean, a lot of people are asking, where do you get these sophisticated people from? Well, my audience, I got here from Texas, just so you know. Don't ask me how I got in touch with her, but yeah, we connected from Texas. So, Doctor, just tell us a little bit about yourself for the benefit of our audience before we...
Sure. Yes. So my name is Dr. Saimun Singla, like you said, and I am in Houston, Texas, which is in the States. And I am a traditionally trained pediatric rheumatologist, which over here means I've done 4 years of medical school, 3 years of general pediatrics, and then another 3 years to do a fellowship to specialize in rheumatology, specifically for kids up to about 18, sometimes 20, 22. It doesn't mean that I don't know about adult rheumatoid, arthritis and rheumatologic issues. It's just that my comfort level is with the pediatric population. And in addition to rheumatology, I'm also trained in something called integrative medicine over here, which basically kind of marries the world of traditional knowledge, traditional Western medicine, along with more lifestyle factors that can affect chronic diseases. So how you eat, how you sleep, how you move, your stressors, and how those kind of can play into your disease process as well.
Okay. Wow. Thank you for that introduction. We know that you are very qualified. Maybe what we're going to do, I'm going to speak less and I give you the platform to answer, especially the questions that we might have. So maybe my first question to you, what exactly is rheumatism?
So rheumatism is a term that, if you look up, has different meanings, but I take it to mean, we use the term loosely, as rheumatology, or the study of rheumatology. And that basically means the study of disease that affects your joints, your bones, your muscles, your connective tissue. And a lot of times those are all related to autoimmune disease or inflammatory conditions, basically where your immune system, which is supposed to fight off different viruses and bacteria and protect us, right? For some reason, there's a little bit of a glitch, and it turns and starts attacking your own body parts. And those body parts are typically musculoskeletal organs, right? So your joints, your skin, your connective tissue. Certain diseases also affect various organs. So unlike other specialties like cardiology or pulmonary, where you're very focused on one system or one organ, rheumatology really affects anything from your head down to your toes. And so each disease is going to be classified based on what organs are involved and what type of inflammation we see.
Wow. Sure. So it doesn't matter how old you are, you can have this kind of a disease.
Yeah, and I think most people get very surprised when they hear that pediatric rheumatologists even exist, because you tend to think of older people with arthritis when I say the word arthritis. But I mean, I've seen as young as 15 months, 18 months develop juvenile arthritis, and it's the last thing on people's minds is, why would a child get arthritis?
Sure. Now, it's very sad, especially when they're small children, and then they're helpless. They can't do anything.
Mhm.
I just can't imagine if you're a parent, seeing your
Yeah.
child going through that, what goes through your minds, your feeling. But it's such a sad thing that it is happening. So, what are
Yes.
the symptoms? Let's say you don't know that you do have that kind of a disease, or you
Mhm.
suspecting maybe your child might have. What should you, as a parent, be on the lookout for?
Right. So it depends on which disease we're talking about, but the most common thing pediatric rheumatologists see is juvenile arthritis. So that means arthritis that develops before the age of 16 years old.
Mm,
And typically the biggest presentation is going to be joint pain or joint discomfort.
mm,
And as you may know or have experienced, a lot of kids have what we call growing pains growing up. So the picture can get a little bit confusing. You're like, is this a worrisome pain that is benign and the child will outgrow? Or
mm,
is this more joint pain that I need to get evaluated by a doctor? Did they hurt something? Did they fall? Did they play basketball and then injure themselves? So the biggest question is going to be, okay, what's hurting? Where is it hurting?
mm-hmm,
And how long has this been going on for? Because in rheumatologic issues in general, they don't develop all of a sudden overnight for the most part. They're like a slow train that just kind of keeps going and doesn't stop
mm,
unless you figure out what's going on and throw medicine at it.
mm,
So one of those things is joint pain is unfortunately the most common thing. So knees hurting, and it's not just pain. You can see swelling there, right? So the joint, as a parent, sometimes I see a lot of parents that are so guilty because they're like, oh, we didn't see that knee was swollen for so long. How did
mm,
we know? I said, that's not your job. Like
mm,
you're not trained in that, right? So it's a very subtle finding. The only marker that you have as a parent is to follow what your child is doing. So are they running like they normally do? Okay, they're complaining of knee pain. Is it stopping them from different things, different activities? Am I having to give them lots of medicine? Does it look swollen and red? Are they having fevers with it? Did they hurt themselves? So these are, you kind of try to run through in your mind of why are they possibly having these aches and pains, right? And the other thing, in addition to pain, that I always say is that, and it's very hard for kids to describe this, is stiffness in the joint. So when you wake up first thing in the morning, right, where none of us are active while we're sleeping, we're laying down,
yeah.
do your joints tend to kind of crystallize and sludge overnight. But for people who have arthritis, that is more pronounced. So when you wake up, you really feel stuck, whether it's in the fingers or in the back or the legs. And then so you're a little bit slower to get out of bed, right? And then you just achy, stiff. And then as the day goes on, that stiffness kind of goes away because that joint is kind of moving and it's less crystallized. So it's kind of one of an indirect marker to see, is my child slower in the morning
Mm.
versus rest of the day?
So it's like a lizard in a way. It has to warm up first before all the joints are warmed up and moving. Yeah, but it's
Yes.
it's not a good thing. Eh? When you're a child, you're expecting a child to be hyper, out of that, just even early in the morning as they wake up.
Right.
Yeah, yeah.
Right. And for the younger kids, like the really young ones that I see, 2, less than 3,
Mm,
sometimes the parents don't know because they don't see it, obviously, but their functionality has changed. They don't want to move their leg while they're putting on their diaper, or
mm,
they're not wanting to walk. I mean, every 2-year-old should be running around, right? It's a developmental thing.
mm,
And when all of a sudden they're not wanting to run or walk, you kind of go, okay, what's happening? What's wrong?
mm. Sure. Okay. So if you only joining us now from Telegram, also on YouTube, you are able to post your question there. If you're on Telegram, you can raise your hand and you can ask the doctor a question straight ahead, and she'll be able to answer if it is possible to answer at this point in time. And you also connecting on YouTube. If you type your question, we'll be able to see it from our side and be able to answer that question for you. Now let's rev ahead now. We've spoken about the symptoms that we can identify, knee swelling, and what actually is rheumatism. But now, could you provide an overview of different types of rheumatic diseases in
Yes,
respective to its
absolutely.
characteristics? Yeah.
So I tend to think of rheumatism or rheumatology as kind of the general term,
Yeah.
as the umbrella term, and there's many different types underneath those umbrellas. One of the things underneath that are classifications is going to be inflammatory arthritis. So that's your rheumatoid arthritis that causes your immune. Inflammatory just means your immune system is inappropriately attacking those joints and organs. So that's like rheumatoid arthritis, juvenile arthritis, that falls into that, term. Then there's other things like connective tissue disease. So just the name implies that, remember, the immune system is attacking the connective tissue. So things like lupus, what I call cousins of lupus, so mixed connective tissue disease, Sjogren's, they attack different organs. Okay, and then there's another category called vasculitis, where the immune system attacks the walls of the blood vessels. And we have so many different types of blood vessels, right? So big ones, small ones. And so within that classification of vasculitis, there's multiple different subtypes based on which blood vessels are being attacked. And then you also have a whole different category called autoinflammatory diseases, which, now bear with me, it's not autoimmune, okay? That autoimmune means the sophisticated part of your immune system has built memory against your own tissue, okay? Autoinflammatory is more primitive. These are things when our body first sees something foreign, like a virus, it just goes and attacks it with whatever it has. So autoinflammatory diseases tend to affect more of the primitive arm. So these are things that cause fevers, periodic fevers. So every month, children can have, and some adults as well, random fevers that last for 3 to 5 days, and then they go away. And then they come back again in exactly 4 months or 3 weeks or 2 weeks. It's like clockwork because the immune system is confused again and just the light switch is turned on and somebody forgot to turn it off. That's how I think of autoinflammatory. And then you have this other category. It doesn't really fall under true inflammatory conditions, meaning your immune system, something has gone wrong, but they tend to present similarly to rheumatologic or rheumatism issues. So these are things like fibromyalgia or chronic pain or even mechanical pain. These people have widespread pain everywhere, whether it's everything in the joints hurt, the muscles hurt, head hurts, belly hurts, but no one can really figure out what's going on. We call that chronic amplified pain syndrome, where for some reason your pain threshold has dropped and everything is processed as pain. The smallest trigger, so smallest stressors cause you to feel pain when in normal setting, it shouldn't do that. And so that's not true it's not categorized as a true autoimmune condition, but because we deal with so many joint aches and pains, muscle aches and pains, fibromyalgia has kind of come into the world of the rheumatologist as well.
Yo, that's a mouthful there.
I know.
So when I was speaking to a friend of mine, in fact, she saw that our poster about this show today. And then she says to me, she has, now that you mention it, goes out of my head, lupus.
Yes.
So I heard that you mentioning it as one of the things or the types of rheumatic disease.
Yes.
Now, those kind of diseases, are they manageable, or can they be, healed?
So the thing with any rheumatologic issue is that it's mostly chronic, meaning once you get the diagnosis, you typically have it for the rest of your life. But it doesn't mean that you can't have a normal life. That's where the issue is. So you have this problem, you have this medical issue and it's chronic, but you have medications to keep everything quiet. So that's kind of how we look at it, is we call that remission. So you have active disease, say you have active lupus or active arthritis. You go to the rheumatologist, they diagnose you, they prescribe medications. The moment your labs are quiet and your physical exam is quiet and no one can know that you actually have something, that point is called remission.
Okay.
And the goal for any patient who has a long-term chronic issue is going to be remission, sustained remission, right? And sometimes for most, I would say for the majority of patients, 60% and above, they need to be on some sort of medication to keep you in remission. You can try weaning it off. You can try testing the immune system and see what happens. but then you risk kind of knowing, okay, you might have a flare and things might be active again. So for the majority of my patients, for example, they're on medication. Sometimes that means the most smallest amount at the most least frequent, dosing. But once you have a rheumatologic issue, it's typically for the life.
Sure. So if you have any other questions, talking to our listeners there on Telegram, like we normally do, just raise your hand there and then we'll give you a chance to ask the doctor. Also, you who are connected on YouTube, please do the same. We're looking forward to your questions. Now, as we're speeding ahead regarding this disease, which is rheumatic, am I right to say it's a disease?
Mm-hmm.
All right.
Yeah.
Because I always need to be sure, because there's a lot of things going on in this planet where different things are quite differently nowadays. So you have to
Sure.
be sure. I don't want to, stumble anybody else. Oh, we do have a question there on Telegram.
Sure.
Okay. Hilda, welcome to the show. You can unmute yourself.
Thank you, Neil. My apologies if the question was answered before. Is there a difference between rheumatism or arthritis, or is it the same thing?
Doc?
That is a great question. So, see, I trained in the United States, so we don't really use the term rheumatism. But from my research and looking at it, rheumatism is more of an umbrella term. Arthritis is more specific. Remember when I said in the world of rheumatology, there's different types of diseases. So if somebody has lupus versus arthritis, their management and presentation is going to be very different. So I tend to stay away from the term rheumatism because it's so broad, and I hone in on the disease itself. So then I'll say rheumatoid arthritis or lupus or mixed connective tissue disease.
Okay. Is your question answered, Hilda?
Yeah, thank you.
Thank you so much. All right. So, how is rheumatism typically diagnosed?
So that is the tricky part, because everyone presents differently and everyone's labs look differently. It's a combination of what the doctor is hearing from your story in terms of characteristics of pain or your symptoms, what they're feeling with their hands, right? Your physical exam findings, and then also your labs. This is where the disconnect happens. Excuse me. Sometimes your labs might show one thing, but your exam is completely normal. So you can never diagnose someone with a rheumatologic issue just based on labs only. Labs are always supportive of the physical exam findings. The exam findings will always trump everything else that you're seeing. Okay, so even if somebody has swollen joints and their labs are completely negative, I'm going to go by what their swollen joints are doing or what my hands are feeling. So it's really a combination of things. A lot of times in rheumatology, the labs are just to help us with what we call prognosis. So your future risk of getting worse disease or how bad your inflammation is. So it's very person to person. There's not like a one medication for everyone. And that's the reason is because these diseases present differently with everybody. So you have to kind of tailor it based on what you're feeling and hearing.
Okay. So those are like the key things that the doctors will look for.
Yes.
Right. So if I have a family member, sometimes it's very difficult to speak to a family member to say, I think you have this type of a disease. I would suggest that you go look for a doctor. And I'm talking about, families that are in the third world countries where medication doesn't come cheap. So how do you encourage somebody, to go look for a doctor? I mean, before this show, I didn't know of the word rheumatism until I made my research and I stumbled upon your profile. And I was like, this is interesting. I would like to know more about it. But for somebody who doesn't know, how do you encourage them to go out?
I think it depends on their motivation level, right? Like you can never force anyone to do anything, first and foremost. So even if you're interested in it and they're having symptoms and they're not, there's very minimal that you can do. So what I would say is, it sounds like you went from being normal to having these symptoms. Are you interested in getting better, or do you want to know more about it? That's step one. If the answer is not yes, it's going to be hard to move past that. Number two is going to be, okay, so from some research that I've done, you can say it like that, like some of the reading I've done, or I was listening to this person, it sounds like you might want to look into the world of rheumatism or the world of arthritis, something like that, kind of guide them rather than tell them. In my experience, when you tell someone that like, hey, you have this going on, you really need to go to this doctor, they turn off. It's more of a human nature thing rather than a logical thing. And so I think it's more of coming from a place of love and kindness, where you say, it looks like there's been a change in your health. I was doing some research. Would you be open to seeing a rheumatologist because this is hurting, or you've been having fevers for every month and we don't know why. It's hard for you to take care of yourself and others as well. So I think you can guide them and say, this is what I've read, and this is where I think we need to go next. Based on that answer, whether it's a yes or no, again, you'll know how motivated they are to kind of help themselves, let's say.
I'm speaking to this. I think men will start hating me because, I can only speak for men, not for women. But I always say this, that my wife always says to me, "No, go to the doctor." And I said, "No, I'll be fine. I'll sleep it off. I'll be fine." Or now, since I'm well over 40, and there's this thing of when you pass your 40 age gap and you're closer to 50, those are the things that you expect to have. But not knowing that even though you expect them to have, you need to get them treated. So maybe it's an appeal to all men. Please, let's see doctors.
That's a good point. That's a universal issue. I will say that. I think that question, that situation actually opens up a bigger picture, which is, what is your motivation for being healthy? Some people just like, why do you eat the way you do? Why do you need to go to the doctor? You don't need to do anything. So, but why is it that you need to do that? You have to have some sense of, this is important to me. Otherwise, it's a extra to-do item on your list, right? Because my wife told me I need to call the doctor.
All right, another question from Hilda. You can unmute yourself.
My question is to the doctor. In the mornings when I wake up, the joints on my fingers are very swollen, and it would be very difficult to try to open the tap. It will be very difficult for me until I can put my fingers in warm water. Then it will be fine. But there's something that I noticed. I'm suffering from hyperactive thyroid. So my results were saying it has become toxic. And since I've started the radioactive treatment, I feel the difference. Would you say I have arthritis, or was it because of the hyperactive thyroid? Thank you.
That's a great question. I don't know that there's a link between hyperthyroidism and feeling stiffness in the morning. There's not as far as I've seen, I guess. And remember, my experience is limited to kids up to 18, 20 years of age. So, but what I do know is, just thinking about the story that you're telling me, if your hyperactive thyroid is due to an autoimmune condition like Graves', it's possible that you can have a couple of autoimmune processes start at the same time. So I would be very vigilant about being looked at for rheumatoid arthritis in the fingers, because I don't know right off the top of my head that hyperthyroidism causes you to have that. But you're also telling me that your medication is helping you feel better in terms of helping with the stiffness. So maybe partly it's helping, but if it's continuing even after your thyroid has normalized and you're on these medications, then you really need to be evaluated for rheumatoid arthritis. It's a strong possibility, I would say.
All right, thank you.
Thank you for those questions, Hilda. I think a lot of us we do have those questions. I remember as well, back home in my teens, when I woke up in the morning, I'll be very slow. Like she was explaining, I could not grab something tight with my hand. I have to warm up like a lizard first,
Mm.
before I'm able to do that.
Yeah.
But it's a
Now,
good thing that
remember
we do
that
have this
that feeling
discussion.
is normal up to
Mm.
about 15, 20 minutes. All of us, it happens to all of us. Our joints are kind of crystallizing and sludging overnight. But again, it shouldn't be for longer than 15, 20 minutes.
Okay. All right. So I should not be alarmed if it's less than that, eh?
Right. For a few
Okay.
minutes, all of us are a little bit weaker and slower in the morning. But if it's past 15, 20 minutes, that's the issue.
Yeah. Here's another question for you.
Mm.
In fact, it's a friend of mine who asked, if you crack your knuckles, does it does it have a negative impact on your joints? Does it cause you to have arthritis?
Right.
Because
I think
growing up, our parents used to say, "Stop doing that, otherwise you'll have arthritis." So,
yes, that's across, again, a universal
okay,
issue, I would say.
yeah,
I think that's more of an old wives' tale than an actual thing,
ah,
because if cracking your knuckles correlated with getting arthritis, I think we'd be much busier than we are. Like, we're busy, but we would be way more busy because
yeah,
a lot of the population cracks their knuckles.
yeah,
That sound that we hear when we crack the knuckles is just a pop in the synovial fluid, just like bubbles,
ah,
and so it's not necessarily that it's going to cause inflammatory arthritis, because remember, that's the immune system attacking your joints. So
oh,
mechanical things shouldn't affect your immune system
oh,
technically, right? For most people, it's more of an annoyance, like the sound
yeah,
of popping, because it gives relief, right, to the
it
person
does,
doing
it
it, but
does,
to the person next to them,
yeah.
they're like, please stop, that's gross.
So when I was reading about that, it said to what I was reading, it said most people do that because of stress relief. When they're
Right.
stressed and they start, crackling their knuckles, and for some reason it gives them a relief of some sort. But yeah,
Right.
would you recommend or not recommend doing it?
It's not that it's good or bad. I think if you're doing it for stress relief
Yeah,
and it's an alternative to you picking your nails or biting your nails, I
yeah.
think go ahead and pop your knuckles.
Mm.
If you can refrain from that, probably just refrain from it and do something else to manage your stress.
Okay, we'll do that. We'll take a walk or jog outside in
Yeah.
the morning.
Doodle.
Or doodle or listen to music.
Mhm.
Yeah, you do have, alternatives to that.
Yeah.
Could you then shed some light on the potential impact that this rheumatism may have on an individual on a daily life?
Yeah. I have personal experience with that, because
Okay.
I was diagnosed with rheumatoid arthritis after becoming a rheumatologist.
Oh, wow.
So
So you're able to diagnose yourself?
I know what it feels like. And I know
Yeah.
that the way you think as a doctor is different than the way you experience arthritis as a patient, right?
Mm-hmm.
And so as a patient, when I first went into the diagnosis, I thought, great, I have a diagnosis. My doctor's going to start me on medications. I'm going to be in remission, but not everyone's story is like that, right? So it's more of like a roller coaster is what happens. And so you feel good probably for a little bit of time, and then you realize, oh my gosh, arthritis is not just arthritis. It's affecting my handwriting, my drawing, me being able to take care of my children. It's affecting, my medications are causing side effects like nausea and fatigue. So I'm having to maneuver childcare. My husband is, thankfully very supportive. So he knows when my medicines are due. Okay, just know that I might sleep in the next day. So there's all these small little adjustments you have to make in life without knowing at the beginning that this is how it's going to look for you. And I think it can get very hard when you first hear someone say, like, your hair is going to start getting thinner. The last thing you want to tell a female, in her 30s and 40s is that your hair is going to fall out.
Yes.
And those are the kind of things that you have to learn to cope with, because your other option is, okay, let's not be on the medicine, but then I'm going to be stiff for 7 hours of the day and not be able to hold my pencil. So you learn to kind of cope with the negatives of it.
So you spoke about getting treatment, being on medicine treatment. With your experience in the field,
Mhm.
do you see if there is any notable advancement in research, in treating this disease? And do you
Yeah.
see any developments that will shape, the future of this?
Yes, definitely. Since I started rheumatology 10 years ago to now,
Mm,
there's been it's almost become hard to keep up with the medications that keep coming out,
mm,
targeting different, parts of the immune system.
mm,
From when I started to now, there's been a huge jump in what we call biologics. So biologic medications are these fancy medications created in a lab to target a specific part of the immune system. Okay. This is different from like steroids or methotrexate, which are kind of like blankets and they dampen the immune response. Okay. So they kind of work on different parts, which also causes more side effects. They work, but they cause more side effects. Whereas the development of biologics in the last 10 to 15 years has really changed the ballgame of rheumatology in general. Because with more research, we're learning that remember I was talking about that umbrella term, rheumatoid arthritis has different types as well, and juvenile arthritis has different types. So the scientists have now tried to make it more, okay, well, this protein is what's causing this type of presentation. Let's target it and see if we can fix it. So we're in a very exciting time period of rheumatology where we're getting more and more biologics, which means we as doctors have more and more options to treat people.
So it's not about the medication that you're promoting. They really
Oh
do
no.
work. Because there's this misconception that companies will go to doctors to say, here's a product for me, sell it. If you sell this much, this is what you gain out of it. And
Oh,
I don't know if it's a
it's
misconception or
yeah. Wait, let me tell you, that's not how it works. And I would feel, honestly, anybody with a conscience should feel dirty practicing medicine like that. So the point of the pharmaceutical companies is to pour money into research to come out with newer drugs to help patients, period, right? Part of that process is marketing their medication. I understand that. But I have drug reps that come and try to give medicines, but what I need them for the most is to give me free samples to patients who can't afford it. That's what I need them for. My decision to start a patient on medication X versus Y should not be based on how much money, because you don't get any money off of starting somebody on a medication. That's illegal here. That first, because we work through insurance companies, so most patients have insurances, and those insurance companies cover your medication. So I have no control in whether your insurance company is going to accept it or not. And so I pick a medication blindly based on what I'm seeing in front of me in terms of labs and the patient. So I think that misconception is there, but I don't know where it came from. Maybe that was more of an older thing, even before I went into medicine, but the system is now where that doesn't exist.
That's good. It shouldn't exist. Let's keep it there, a misconception. So let's expel another misconception, and this time for rheumatism. What are common misconceptions about rheumatism? And what key messages would you like to convey to our audience?
I think in the world of rheumatology, a lot of our illnesses are invisible. Like if you look at me, you probably wouldn't have said, oh, she has rheumatoid arthritis,
Nope.
versus like a cancer patient, right? Based on the hair loss and things like that they have this diagnosis. So even if someone says they have an illness that's chronic, I think I wouldn't judge it based on what they look like.
Yeah.
What they look like is a combination of like internal resilience and good medication, right? So it's, and know that people with invisible illnesses are allowed to have bad days. Like you can, lack of sleep could be causing a flare. So you might have to ask for work accommodations, and you shouldn't judge them for that. It doesn't make them any weaker. Right. And that same thing goes to the patient who has that invisible illness. It's not that you have to physically show signs of a disability. I think it's enough to know that you have this diagnosis and you're doing your best to kind of maneuver it and cope with it.
Okay. All right. No, thanks for explaining those misconceptions. What advice would you offer to individuals who have been diagnosed with rheumatism, as well as to their friends and families,
Yes,
support
I
them?
think, again, be ready for that roller coaster. Sometimes you're going to be coasting, right? Your medication's working, everything's working out, you're traveling, you're eating what you want, you're doing what you want. And then sometimes that's not going to work. So you're doing all the same stuff, but your body's in the middle of a flare. Your immune system has been activated for whatever reason, right? And it doesn't mean that you've done something wrong. It doesn't mean that this is going to be like this forever. I think those periods are all snapshots in time, right? With any chronic illness, this is not just rheumatism, but you're going to have this ebb and flow, and that is life. That's life in general, but also life more specifically with the chronic illness, where your immune system can be very finicky, and be good one day and be bad one day, and that's part of the process, unfortunately, part of the journey.
So I know you treating or you practicing in the Texas area, but with your research, is there a lot of people that are suffering from this?
There are, actually. Unfortunately, I would be out of a job if there weren't.
Oh yeah.
But a lot of times it's also people coming in to make sure they don't have a rheumatologic issue. So their child has been having lots of aches and pains. My job is first and foremost to make sure this is not an inflammatory condition that I need to treat with medicine. The second line is going to be, okay, if you're having these aches and pains, how can we help you? Do you need physical therapy? Do you need something else? Do you need to see a different doctor because it's actually this? So it's a twofold process, is that we make sure it's not this, or it is this, and we treat, or how else can we help you? So just with those questions, we see a lot of patients. I would say in general, rheumatologic issues are less common in kids. It's kind of more of the rare diseases, but out of those diseases, the most common thing is going to be arthritis, juvenile arthritis.
Okay, all right. That's one of the diseases I'm afraid you have, arthritis. But are these hereditary or?
It's a combination. There's a difference between rheumatoid arthritis and what we call osteoarthritis. Osteoarthritis is something most of us might get when we get older. It's the wear and tear, just like a car, right? We've been using our joints for most of our life, and now the cartilage is starting to kind of break down. That's osteoarthritis. Rheumatoid arthritis, remember, requires medications to kind of calm the immune system down. And so, hereditary factors definitely play a part, but it doesn't mean that you are destined to have arthritis just because your grandmother or mother had it. Okay. There are factors. So you're born with these set of genes, and there's other things in the environment that can kind of trigger those genes to come to light. Okay. So that includes smoking, a lot of lifestyle factors. So smoking, periodontal disease, obesity, all those kind of things kind of affect whether or not a person who already has this genetic makeup to have an autoimmune disease actually has an autoimmune disease.
Yeah. Okay. You're speaking about diet. Lifestyle. So do you need to have a specific diet when you diagnose with rheumatology?
The $1 million question. I wish there was one specific diet out there that fixed everything, but that's just not the case.
Okay.
What we do know is, and what has the most data, is what we call the Mediterranean, sorry, and anti-inflammatory type lifestyle diet. So that includes fruits and vegetables needs to be your big basis. Okay, fruits, vegetables. When we're talking about grains, we talk whole grains. Okay, so not like white flour or bleached flour. And this is obviously, you have to take this in the setting of what's available to you, right? It's not, if it's a luxury to get fresh fruits and vegetables, and we do the best we can with what we have. The other stuff is, so omega-3 fatty acid rich food, so salmon, nuts, almonds, walnuts, olive oil, olives, chia seeds. Those are very rich in omega-3, which is kind of the good fats that you want to help fight inflammation. Okay. And if you can't do any of that, the biggest advice would be decrease your intake of processed foods. So that's your fried foods, your frozen foods, the things that you pull out of a freezer and then you just fry. Those are probably not so great for you. And so you have to, again, everything has to be taken in the setting of your resources, what you're around, and what you can do. And so the more whole food, plant-based diet that you can do, the majority of your diet is that would be better. The less red meat, poultry over red meat, salmon over poultry. So it's like meat at the bottom, red meat, poultry like chicken, and then salmon. That's of the
less red meat. Oh no.
And it doesn't need to be like, if you're eating it every single day, I would say that's probably not so great for your cholesterol either.
That's what you're saying.
Moderation.
I think moderation is the key to a lot of things, eh?
Right.
Because when we overindulge in eating, whatever you eat, the more you eat something, it can go bad for you. So moderation is the key. Now, you talked about diet. What about exercise?
Yeah, exercise is huge. And when I say exercise, there's two types that I'm talking about. One is cardiovascular, where you're sweating, your heart rate has gone up. So things like walking really fast, running, cycling, those type of things. And then there's strength training. Both are important. After a certain age, strength training becomes really important. So I would say strength training is where you build a lot of long-term benefits, including bone health. Most people don't know you can build your bone density by weightlifting. So, and repetition too, right? So simple things that you can do. It doesn't require going to a gym even. It just requires challenging your muscles. That's all. So you would, ideally you want to get in, for kids, 60 minutes a day, which sounds like a lot, but kids are running around for 60 minutes a day easily, around the house, outside, at school, things like that.
Yeah.
If you can't even do that, start small. So 2 days a week, 3 days a week, ideally 5 days a week, but I don't know a lot of people that can stick to that regimen to do 1 hour, 5 days a week. You have to be really, really motivated. So I would say start small, 2 to 3. Pair the exercise with diet, and you'll see long-term lasting effects.
No, thank you so much, Doc. This was very interesting. There's a lot of things that I've learned from this topic. And just to think, I only associated just one facet of a disease to rheumatology. I'm now, my eyes are open to a lot of things that I need to be on the lookout for. And thanks to you for, enlightening us there. And also thanks to our audience there on Telegram for sticking up. We really appreciate you joining us and listening to the show live. This show will is recorded and will be posted on YouTube, but we do have a live show going on YouTube of this current episode. So, Doc, just to wrap up now. Wrong button there. This is supposed to be the one. As we wrap up now, what advice can you give to the audience regarding rheumatism?
Let's see. I think, what advice do I give?
Yeah.
I think kind of what I alluded to earlier about having an open mind. If you do end up with a type of rheumatism, I would say don't be too hard on yourself. This is nothing that that you did, right? It happened with the right hit of environment and genes. Be open-minded and be willing to learn. So you're going to learn throughout the process. You're going to learn what you need to change in your lifestyle and in your medications, and be open to that. Be open to that journey.
All right. No, thank you so much. And
You're welcome.
Thank you once again to those that have connected on YouTube, and also you on Telegram, and your questions. We really value them. And Doctor, thank you so much for giving us your time, your precious time. I know it's raining out there. I wish it was raining on our side because I'm really hot in the studio, and I really need the rain. So, but thank you so much. And the internet really, respected us this time. We didn't lose you there.
Even in the rain. I'll send rain your way.
Please do. Please do. Yeah. All right. So, thank you everyone for joining our talk show. We do have these shows every Monday at 6:30, and we welcome your comments, your suggestions towards the show. And if you have anything that you would like us to, to present on the show, you're also welcome to suggest. So my name is Neo Morapedi, the host of NMP Talk Show, and this is how I'm signing out. You need internet? You need